I've really been enjoying my practice in the mental health space. Like I find it very rewarding and sort of it's fun, right? Because you get to use your people skills and your conversational skills, which is something that not every physician graduates with. And so I do find that sort of a unique area where you have value to add as well. I imagine similar on your end.
Totally, yeah, absolutely. And I can't speak for anyone else, but I know it was one of those things I never really loved. It wasn't definitely wasn't like the sexy area during like your medical school or residency. I remember our rotations were just like, yep, show up, just say hi to the patient, and yeah, you're home at 12 o'clock and enjoy your life. But like, definitely not something I think I'd be able to do for the rest of my life. But yeah, I think, when I was in my family medicine rotation, or family medicine practice, it was that was kind of the intervention. I started realizing that if we could just give these people a little bit more of our time, which was kind of so precious in the clinical setting, that maybe we can start to kind of break down like, okay, why are you having this stomach upset? Or why are you kind of no longer talking to your friends? What's going on with that? But sometimes in that 10-minute visit, like you can't even scratch the surface. So just having the privilege to have the time to sit down and talk with people and take like a thorough history is actually super rewarding. I don't know if that's kind of your experience as well, or kind of how you
Oh,
enjoy that
well,
working.
thinking back to medical, like I went into medical school not knowing what I wanted to do, but I was certain I didn't want to be a family doctor. That was like the one fact I knew to be true. And here we are. So there was like, as a kid, my only experience ever going to a family doctor is when you got a wart at the swimming pool. Then you'd have to go back and they'd cryotherapy it, and it was awful. And then so that's what I pictured family medicine was like pre med in my science degree. I was like, okay, it's just dealing with warts. And as a bit of a germaphobe, I was like, I don't want to do that. That sounds terrible. But then you get into your actual clinical rotations, and it was like, oh, this is actually really cool. There's a lot of stuff going on here, and it was really, really interesting. And so then by the time you get through medical school, it was, okay, I want to be a family doctor, actually, and an ER doctor. Those were like the two number one things on the plate. And then wound up doing family med and worked in a bunch of ERs, did a lot of rural work. And it was really awesome. It was really fun. But then, of course, wound up, you know, chasing the tech world, right? And going down the entrepreneur route. Sort of, for me, it wasn't really that there was something that I didn't like about family medicine. It just was kind of this window of opportunity that I kept going down. I don't know if there's, I don't know, was there anything like magnetically pushing you away from the family medicine field as you went through your career? Like, why did that suddenly, the bread and butter family practice clinic, fall off the table?
I think I know obviously right now things are a little bit more magnified here in Alberta, kind of post COVID and things like that. But I mean, I also realized that, things weren't great even pre-COVID, right? I think
Mm-hmm.
COVID really revealed a lot of those kind of glaring holes there. But that was kind of something that was always on my mind as well too, was just like, it's a big ask to just kind of say like, hey, I'm going to settle down in this community and this is where I'm going to stay. Because, I think doing family medicine, you really, and this is something I don't think I've gotten in any other kind of career that I've had since, is you get that connection that you can only get in family medicine, that, you're seeing them for sometimes cradle to the grave kind of thing, right? Your panel is 0 to 99 years old, and you're able to do so many more procedures. You're the one kind of clearing off these forms, all the WCB stuff. As annoying as it was, it's kind of cool to be the person that kind of can help get them back to work, or you can vouch for them, and your word actually has some meaning to your word has some weight to it. Um, but yeah, I think I just felt so guilty that, if I couldn't commit to this practice for almost the rest of my life, like what if things changed, and I had to move, I'd feel so guilty just abandoning these people. And, just having those thoughts and saying like, yeah, I just wouldn't feel right just kind of working people up in a certain way and then abandoning them. So that was something that really kind of started pushing me away to something that I could kind of still help people out. But I also wanted to make sure they had somebody that they could probably go back to, and family doctors that were able to kind of spend the long term with them and able to commit to that. So that was kind of my reasoning why I kind of started pushing away from family medicine a little bit.
It's interesting that the expectation itself is thwarting people from going into it, right? Just that sense of permanency and like you're getting married to your patients, right? And the guilt that would follow if you had to break up with them, I guess, so to speak, right? And that just the medical legal ramifications of like closing those charts and like responsibility for those patients, right? But yet it's like actively dissuading people from going into it. Maybe they would have gone, and maybe you would have done more of it if you didn't feel that like such a sense of everlasting permanency with it. Maybe for a short period of time, maybe for a medium period of time, who knows?
Yeah, I think that's one of those things that, they never really, it's never really explicitly said. It's just kind of implied, that when you're going through all your training, you go to these rural areas, and a lot of the preceptors you're working with, uh, even urban or rural, are like people that have been in their practice for, honestly, like, unless they're a new grad, like 10 plus years. So you're kind of seeing like a fully established practice, and it's all full go. And like a lot of the stuff that they've got going for them, it's like it's easy because like they've been there for 15, 20 years. But I don't think they necessarily show you that process of getting started and kind of the hassles and building your practice, kind of shaping your panel a little bit. And yeah, I mean, it was super sexy when you kind of showed up, and it'd be like, oh, hey, Tom, how you doing? How's Janie? How's Steph? How's Keegan doing? Like, oh, great. Like, everyone like, wow, this is just a conversation. Like, this is fun. But yeah, when you actually get out there and kind of understanding the permanence of it, it was a little bit tough for me to kind of see myself doing in the long term there. So
I'm Dr. Jordan Vollrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.